So it looks like she's backed up all the way here, and we are ready to start the Skinmedica Rejuvenized peel. Take a good listen to this. You guys are going to be able to ask me questions at the end. This is the presentation of the Rejuvenized peel.
Okay, so we are going to be performing Rejuvenized peel today. This patient has very good skin and very good condition. It does tend to be a little thicker and have a little bit more acne once in a while. We start with the #1 solution, which is a prep. It removes all the oil off of the skin so that the peel absorbs evenly. Smells a little bit, so we like to leave the fan on.
It's a little alcoholic.
Yep.
So it's not bad.
Nope. This is the Rejuvenized peel. It is the strongest of the Skinmedica peels right now. That is considered the prep layer. I like to apply, they tell you to do it with the cotton. I usually do it with the Q-tips. Reason being is that the product is not being absorbed into the cotton. You're actually using it nice and evenly on the patient's skin. Obviously, we want to avoid the eye area, but get close. We don't want anything dripping into the eye. Working underneath the eye area will help to smooth soft little lines under the eye, give a new fresh texture to the skin. I always like to say peels are like teeth whitening. I think they brighten your skin so beautifully and kind of hit a reset button at the end of summer to get rid of all of the dead skin that you sort of collected on your little trips to the beach and the pool with all the layers of sunscreen. This patient does a very good job with sunscreen. You can see that her skin is not tanned. She is Italian. She has beautiful tone, but she's not suntanned at all. We're going to work on the soft little pigment here on the sides. After a series of 3 or 4 of these, which should be done once a month, she will notice much brighter, healthier looking skin tone. Her at-home products will work better, whether she's using all prescription or partial prescription, partial cosmeceutical products. That does vary from patient to patient. Their lifestyle, medication, what their goals are. If you are using prescription skincare, we do have you hold the use of the tretinoins, hydroquinones, and all of those types of products for 1 week. If your skin feels normal in 1 week, you can go back to the prescription. If it does not, we usually have you wait up to 10 days. Winter time tends to be a little harder because of the furnaces being on, so it makes our skin not want to bounce back as quickly as the warm humidity and all of that. It tends to actually help our skin more than what we realize. This can be done full face, neck, and there can be a smidgen left over for chest. So again, this is layer #2 in the Rejuvenized peel. Layer #3 is going to have a little bit of resorcinol, retinol. It's really going to make sure that the patient peels well. Some of the soft little frosting you're seeing is because she uses medical grade skincare. That's actually a good thing. It means she's going to get a nice peel. Typically our faces can take a little bit more than our necks. Our necks want to give us a little bit more pushback and little irritation, so you may have to use like a Vaseline on your neck, where your face can sometimes take a little bit more. So now we're going to move into step #3, which again is going to be the retinol and resorcinol. You're going to notice that it has a yellow little tint to it as we're applying up over top. These peels are self-neutralizing. You do wear them home. If you are an early morning patient, you can wash your face before bed. If you're a later in the day patient, we usually require you to sleep in the peel. During the winter time, that can sort of be bothersome because your skin can feel quite dry. So as long as usually you're noon or before, you can wash your face around 10 o'clock before bed. And you see it has a light little yellow tinge. As it tends to oxidize during the day, you will notice a little bit of a yellow hue starting to get a little darker, you can always take a bronzer, a mineral bronzing powder to put over top. We just don't want you to do any liquid type foundation because it will liquefy the peel. I would rather you stay inside, clean out closets, aren't really in the sun. Can't go to soccer games and sit outside for hours, anything like that. During the week of the peel, I just sort of want you to have as minimal outdoor time as possible. So winters tend to be the best. I also think these are excellent to prep for lasers. If you do 3 or 4 of these and get your skin in really good condition, then the doctors are able to choose a really great laser appropriate for every patient to give you an even better outcome. How are you feeling? Okay, Bernie?
Nope.
Okay.
A little tingling?
Tingling?
But
Okay.
not burning.
Some patients experience more. I think the healthier the skin, sometimes the more burning you'll feel. But you definitely respond very well to peels, so. And the one thing that I want to say is that, you know, I feel like when you're keeping your skin healthy and wanting everything to stay younger and firmer and tighter, the pores to be better, you want the surface of the skin to be in the best condition it can be in. Peels will really help you achieve that quite quickly. There's not many people that walk the face of the earth that don't need one from time to time. So then we would finish with a nice sunscreen. Again, if you don't want to liquefy the sunscreen, you can do a Color Science brush over top. Or the
Okay, now we're going to go to our first before and after. So this is a young lady who did peels. You can look at the pre-treatment there and see that she has, oh, it went gray, Nina, that she has some of the, thank you. You can see that she has some dark here, where on the post-treatment she does not. You can see the sallow, the darkness around the eyes. In the skin here is brighter. I still think that she could use some laser. She was an acne patient, probably as a young person. So, but what my point with this photo is when you see the pre to the post, you see the skin is healthier, it's brighter, she feels better, and the skin is going to be in better condition for it to be treated with the lasers by the physicians. We've already gotten rid of the sallow. We've already gotten rid of the dark that would be inside of some of the acne spots. The other thing is you probably in this patient would also be doing a hydroquinone, a retin-A, making their skin more just evenly, the tone is more even. And if you are on a hydroquinone pre-treatment to a laser, I think that's always easier and better for you and for the doctors to not worry if your skin could pigment a little bit. So I think it's really good to have something like that. So we're going to go to the next photo. This person actually was a really very sweet to let me use her forehead. She had a lot of pigment, so a lot of sunroof driving, a lot of outside, is a nationality. I believe she is Italian, I think. So she did Obagi, definitely, hydroquinone, retin-A, and a series of peels. So again, you know, when you're looking at the post-treatment, it's very good, but she could still use some help from the physicians, you know, seeing somebody talking about lasers, different things that we could do. It's very tough to take a skin from this pre-treatment to this post-treatment without doing regular skincare at home and taking care of it and preparing your skin for a laser and things of that nature. You know, a lot of times before I worked in dermatology, I was in plastic surgery, and people would come in sometimes and say, gosh, you know, I did this big series of laser and now my skin is right back to the way it was. And I think where a lot of offices tend to miss the boat is they don't give you guys the tools that you need to take care of yourself at home and to keep yourself, you know, perpetuating your progress when you're not with us. You don't want to be prisoner to coming here all the time. You know, people are busy, they have things going on, and our bodies make pigment. I mean, whether it's because you were pregnant, whether it's because you got too much sun, it's just your nationality, you know, your family tends to get pigmented and things of that nature. it's something that you need to take care of on a regular basis. So retin-A's, hydroquinones, peels, all of those things can really move you in a stronger direction to prepare for a laser. So that is something that I think this photo is pretty dramatic. And she's actually made progress since this photo, and she'll continue to. But somebody who has pigment to this magnitude needs proper, care at home, and a lot of follow-up. You want to come in, even if it's free, to just sit down and say, hey, I'm using retin-A. This is how many times a week. This is how often I'm using hydroquinone. What else should I be doing? Microneedling would be really good for her to, allow those products to get down into her skin properly as well, if you were not wanting to try a laser. So we're going to go to our next photo. This is, I believe, going to be Libby. Yes, so Libby's skin is very good. She works here with us at the clinic. She was very sweet to volunteer to be one of my patients. She definitely has an oilier skin, which you can't really see in the pre-treatment, but she fights acne. She can definitely get red in her T-zone here. So we did a peel for her to help with some of that redness. When you see her post treatment, her skin just looks brighter. It looks healthier. It's got a nice color to it. It almost looks like she could be wearing a tinted moisturizer, and she isn't. So she feels really good about that. She could be just using a nice SPF. This was actually only one peel as well. So she does certainly use retin-A. She is on some prescription products, but all in all, every once in a while, you need a little kick at the end of the season to sort of get some of that stuff off the top layer. And she was quite happy with her results, and very sweet to volunteer for me. So our next patient is going to be Nina. She's who takes the pictures of you here at the clinic. We love her. So she was really happy about her nose. She is somebody who's super sensitive. Her skin can get really red, get very irritated. So she had only one peel as well, just to kind of prepare so I could have some before and afters. And why I wanted her to kind of zoom on her nose and some of the blackheads and things like that is because people come in all the time and they're like, I want you to extract every single blackhead off of my face. And that's really hard to do. What that typically means is we've worn some mascara, it's gotten in our pores. There's some things that have happened to us along the way wearing the masks. That does make your skin back up a little bit. Peels help to kind of take that top layer off and let the bottom rebuild. So you're basically self-cleaning your skin, if you will, from the bottom up. I think it's much better than somebody digging. That's not to say that you don't have a blackhead, a pore, a thing that needs things that need to be extracted. But when you're talking about the little tiny pores along this cheek area, if we blew this up even more, you would really see this is so much cleaner. So if you think about a third and a fourth peel after something like just one, and mind you, I did this very sensitive. So this would be somebody who's like nervous. I'm allergic to a lot. I want to peel, but I'm just really scared. Don't hurt me kind of thing. Hers was done on a very sensitive track where the liquids that are applied are going to be comfortable. You're not going to have a hard time. It's kind of like dipping your toe in the water, but you can still get a nice treatment out of it. And then I put a retinol cream over top. So she then did peel really nicely. And she also had hers face and neck, because again, our peels and our facial treatments include face and neck. So now we're going to go, and thank you for volunteering, Nina, to science. We're going to go to the next one. The next one is Shane. So Shane also works here at the clinic, does our makeup. We love Shane. If you look at the first photo, you can see Shane's skin has changed tremendously. So this was really starting at the clinic and now up to today's date. Shane's, before photo of the peel was not quite as pronounced as this pre one, but I wanted the pre one because I wanted you to see in a very short period of time, Shane has changed the texture of the skin, the brightness of the skin, some of the dark that you see. Your skin builds up. I always tell you guys, your skin's like a trash compactor. Things sort of harden and get tough at the top. A lot of times people try to hydrate that with moisturizer. They try to do all these things when really what you want to do is you want to change the surface of it. So the way we do that is good Retin-A use at home, healthy products, obviously sunscreen. You can see Shane is very good with sunscreen. We're resurfacing those cells to constantly have new fresh skin. When you come in and get fillers and Botox and all those kind of things, and your skin looks like a fresh, healthy pillow that took a big drink of water, that's the best way to do anything to it, even a laser, because your skin is just, it bounces back better. It takes the treatments better. So, you know, teaching you how to take care of your skin here is something that we love to do so that you can maintain it. I think it makes everything you do here, your money last longer. I think your outcomes last longer. People will say, my gosh, you're aging backwards. This is weird. And sometimes it's not, you know, tons of things that you do other than just really good skincare. It makes such a huge difference as you age. Shane is quite young, so it's kind of cheating. You know, the skin will change quickly, but you can see the acne. Now, one thing Shane said is, I want to peel. Even though Shane's skin was in very good condition when I started it, I did do an aggressive one, and Shane loved it. I mean, peeled for several days, not a lot of irritation, kept running to me on a daily basis, like, look, 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 it's peeling again. I'm so happy. So I think that you know, the peels last longer, the brightness of your skin. It's basically the stronger of something you choose, the stronger and longer the outcome is basically how I usually try to teach you guys. So thank you to Shane. We're going to move on to our next photo. This is going to be Skinmedica Diamond Glow. Susan from the front desk, you guys may recognize her. She was also very sweet. And I'm going to say before we start the Diamond Glow, Susan is another person with skin like glass that never goes in the sun, wants to peel. She's like, you know, comes to me and literally says, Jill, I want my face on my shirt, which is hilarious because you wouldn't see a pore on her face. Even somebody with gorgeous skin like that, once in a blue moon, loves a really good peel. So you could always talk to her as you're checking out, but most of the girls up there love them. So we're going to go ahead and start the Diamond Glow presentation now.
This is our Diamond Glow skin treatment here at the Parker Skin and Aesthetic Clinic. We start by making sure the patient's face is cleansed. We assess the skin to see what grade of exfoliation we would be using, that we would be twisting onto the handpiece. Inside this little handpiece tip here that I'm going to show you, there are different grades of metal chipped diamond so that we can do the proper precision and exfoliation of your skin. They're all shown here on this brochure.
Each one of those represents a different grade of the exfoliation that you can choose.
We're going to apply a plastic tip, and we're going to be putting the TNS Essential Serum through the handpiece, where the handpiece slowly moves across your skin. It exfoliates, extracts, and infuses the skin with whatever of the Pro infusions that we use. If you are a Skinmedica loyalist, we find this procedure is highly sought after. It makes your skin brighter, fresher, healthier, smoother. It helps with fine lines, roughness and dryness, dark spots and discoloration, dullness, and skin congestion. At the end, you can add one of the Skinmedica peels very, very lightly to promote healthy cell turnover. This would be considered more of a medium depth of the diamond tip being used right now. The first pass has the grit attached to it, and the second pass does not. It's a clear surface that is smooth so that you can deposit as much of the product in without doing any exfoliation during that time. We like to say that it's a lot like a power washer. We feel that your skin is being cleaned at the same time, removing debris at the same time as the product is being deposited. Today we are depositing a hydration. For this patient, we have the TNS Essential Serum. Infusion, we have one for acne. We have vitamin C, and we have skin brightening. Those are usually chosen based on each patient's wishes and their determination of how fast they would like something taken care of. These are very nice treatments to just get ready to go to a wedding or a party of some sort. Not your heavy hitter downtime products. It's going to be more, you feel brighter, healthier, rejuvenated. We will be removing dead skin. You can see she has some of that buildup here. This is a heavy Retin-A user, so she does peel quite a bit, making her face a little bit more flushed and red than some people would tend to be when they get this treatment done. But it still is a very nice treatment for her. It can be used on all Fitzpatrick colors, ethnicities. The other nice thing about this treatment is if you feel that you are fighting pigment or acne, we can do a series of 6 of them for you. We rotate those every 2 weeks. So it's 1 every 2 weeks for a series of 6. A little more aggressively done if you have pigment or acne. Most treatments can have 2 of the liquids infused. Today for Susan, since she has a lot of peeling going on, what we're going to do is just the hydration. So we're going to make 1 pass again with the grit and 1 pass with the smooth. Typically when we use the TNS Essential Serum, that is also only 1 serum. When you are doing brightening, vitamin C, and clarifying, we use 2, so the hydration would follow. She doesn't really need brightening. Her skin is beautiful and bright. She doesn't have pigment. Very heavy SPF user. So she's very, very conscientious of the sun and does not put her face in the sun at all.
That's true.
It's true. No, you really don't. I mean, there's not a lot of people that can say that. So you're very, very careful with it. So for her, she could do the TNS Essential Serum, or she could do the hydration. We picked hydration today because it's winter. It's cold outside. It's a great time to have hydration added to your skin at any point. So now that we've done all the way down to her collarbone, we are going to take this tip off, unscrew this metal tip here, turn that off so you can hear me a little better. So this is where the clear tip comes into play. You can see at the top it's very shiny. There isn't any grit whatsoever on there for the patient. So it's going to feel much more smooth. You're going to feel a nice, the product feels cooling, and it just glides very nicely, so it feels very comfortable. This tip can also be used around the eyes and around the lips. You can, for putting hydration in those areas that can have more delicate skin, especially in the winter. We don't want to upset around the eye area there. So now we're going to make the last pass here with the clear.
Since we
And
had
at the
some
very end,
technical
even though she's
difficulties, we
peeling
can
a little
probably
bit,
skip
she
to where we're
decided
putting
that
the
she
peel
wanted
on a little bit.
soft.
Maybe just move a little bit. So basically this is gliding very nicely. We're just finishing the second round. Then we go ahead and go around the mouth, around the eyes. I just don't know how long you guys have before family and dinner. So the next is going to be, we're going to put the aluminized peel on. And the aluminized peel you actually wear home. So Susan has that histamine red response. Again, that's because she is a Retin-A user.
The other nice thing
She
with
probably
this
does every night,
peel is
to be
that
honest. So you can see that she's maybe going to frost just very lightly.
But it actually doesn't. It's a fan for you, darling. And so what we do is just get it on thin and even. Very, very light, nothing too heavy. especially because of the redness and the condition that her skin is in. We don't want to overdo it, but we just want to make her nice and bright. So some of the fine little redness and streaks and things that you see won't be there. They'll go away. Part of that is just her own skin type. That does not happen to everybody, but it's okay because we know that it will go away. So very, very light. We can leave this on several minutes. Add some moisturizers. We could do a thin little sheet mask if we want. We do try to customize things a little bit according, again, at the ending of the treatment, the same way we would the beginning of deciding on the depth that we're going to use of the diamond tip and the type of liquid. We want to make sure the ending is also customized by, you know, types of vitamin C or types of hydration that we would use, and the type of mask. And of course, with any treatment, when they leave our office, they always have on sunscreen. So I encourage you to talk to your providers about the Diamond Glow.
Thank you.
You're welcome.
Okay, so do we have any questions so far about Diamond Glow or peels? Will you peel from this procedure? Typically not. It depends on what you're doing at home though. Some people can a little bit, but not usually too much. It might be like you used a retinol on a light little flake. You're not going to peel a lot. It's the idea behind it is if you want it close to an event, you might not want to add the peel on. Like, let's say you're going to do it 2 days before an event, forget the peel. If you want to do it the week before or the Monday before the Saturday event, you could add the light little peel. Because your skin is nice and open, all of those brighteners are put right into your skin, so it works quite nicely and quite quickly. But it still is not going to give you that wow, like a big peel, you know, that you really should try at some point. It's the biggest thing is just your calendar. You got to figure out a time and you have to muster up the guts to do it. I think once people do it, they definitely are very happy. Yes, you can apply makeup the next day. The next day after a peel, makeup can be worn, but as your skin starts to dry and it almost gets a little crackly on a big peel, I'm talking now, it gets harder. So you're almost better to just layer on some heavy, thick moisturizer, put your little mask on, and you're going to peel in 48 to 72 hours after that liquid peel was applied. So again, if you're a morning patient, you can wash your face at bedtime. If you crest after noon, unless you're a night owl, I usually have you sleep in it. She has an allergy to Retin-A. Can she use the Diamond Glow? Yes, you can. Yes. So we can also help you with some allergy issues when it comes to Retin-A. So we can cover some of that at a consultation. You know what, it depends. So here's the thing. So the question was, it sounds like you won't see as much of a result as you would from a chemical peel. So I always try to say, you guys want to rotate what's going on, right? Like if you feel like, okay, I've been beating myself up with Retin-A, it's working really well. I had a heavy chemical peel. Now I just kind of want to do something that I want my skin to be bright, or I've got a baby shower, I've got a wedding. I'm tired of beating myself up. I just want to go and get something that's nice. I want to be bright, but I don't necessarily want my face on my shirt. This is going to be your Diamond Glow or your Skintrinsiq that we're going to talk about next. So I just wanted you to know that there are options, hydrofacial then too, and Willoughby. I just wanted you to know that there are options that you can do that aren't the old fashioned facials where we're just basically layering, steaming and things like that. But there's treatments that we're putting things deep into your skin. And I feel that the results of those last, you know, at least up to even 2 weeks, that people are pretty happy with them. And you're welcome. That was a very good question. So now we're going to go on to the next one, which I believe I don't have memorized. I'm sorry. It's maybe Skintrinsiq. Okay. So Skintrinsiq is our new treatment. We were one of 7 practices across the country that got this new machine by Obagi. They're now being manufactured and sold very slowly, obviously, because of COVID. It's hard to get equipment, but I was super excited that I was asked to do a clinical trial for them. So I'll explain how that went here in the video. I'm going to now go to California in a week and a half and speak at their national sales meeting on the Skintrinsiq. They're going to use some of my before and afters that we did a clinical trial here for them at the clinic. So I was super excited about that. This is Obagi and Skintrinsiq. Our Skintrinsiq treatment by Obagi. It is a new machine. We are one of 7
offices that were selected across the country to launch this new technology. The machine does a really nice job with the LED light technology. It has a blue and a red light capability that can be simultaneously changed as it glides softly across your skin. You're not going to feel any of the diamond tip like you would in the other procedure. This one is very soft, it feels very smooth. Patients say their skin is glowing, brighter, healthier, and that it lasts for more than 2 weeks. We think this is a very nice treatment for people that are Obagi loyalists. We can customize the serums that go on to the face. We would choose things such as vitamin C, Elastoderm facial serum, Elastoderm eye serum, and we can actually put them in different sections of your face and penetrate it deep into the skin with their light technology. We are very happy with this treatment. We also did clinical trials for them that were very successful here at the clinic. 10 patients participated. They had to stop their prescription products during the treatments, and at the end, all of them were very, very happy with their skin. They felt brighter, healthier, red carpet ready. Some of them said just a beautiful, healthy glow. They wore less makeup. There was no downtime. And you can also add a peel to this, which is the Obagi Radiance Peel. It can be put in the middle of the treatment. If you are an Obagi loyalist, you are using Retin-A on a very heavy track, as most people tend to do in the winter. You will not have this treatment feeling aggressive. Your skin is going to feel like it had a big drink of water. It's brighter, it's healthier. We can get right up in the eye area, as you're seeing here, with the handpiece gliding across the eye area. It's very, very nice. So what we're doing now is making everything nice and open, clean, and ready with this red light. You're going to see that her skin starts to get a little bit flushed and bright. We're starting to see the nice flush pink into her skin getting nice and bright, partially from the suction and partially from the red light. Wakes all of the cells up, gets everything ready for the next process, which is going to be a very light, soft chemical radiance peel. Also by Obagi, it can be put in the middle of the Skintrinsiq treatment with very little downtime, usually none. The skin just gets really nice and bright. And then we go on to the final infusion, which is completely customized per each patient's wishes. I also cross-customize sometimes, where we do some firming on the neck or the chest, and we may do skin brightening, which would be Obagi FX, vitamin C, eye cream, and then we finish with a Hydrate Luxe product at the very end. We would move into the peel process. We are now going to evenly apply the Radiance Blue Peel. It's very light. She can leave.
You see her skin get a little flushed.
Go about her day.
The other thing with the peel is this peel is in the middle, where the Skinmedica one is at the end and you're wearing it home. So the peel is put on and it's neutralized in the middle. And then we're going to customize the products that we use at the end. And they are being forced in with the LED light. So she's going to show that now.
The other thing I did ahead of time is I prepared products off to the side for Lisa. So today her little cocktail is going to be 10% C first. Put several drops on the face. The thing I love about Skintrinsiq is that you can actually customize all of this for your patients. You are not
yeah, I don't want to talk over myself. But Lisa was someone who participated in the study, and she actually did see her pigment get better. And she said that when she went back to her New system, she felt like her skin was kind of supercharged from it. So I thought that was a really interesting comment. Her pigment on her forehead tends to be her issue. I am 53 and she's just a little teeny bit older than me. So I had that question in the last comment. So I think her skin is beautiful. She also wears very good sunscreen. So here we're customizing. There's going to be some eye cream. There's going to be some, for the lip lines here, I actually did use the eye cream. So, you know, we customize where we're putting all of these products, and then we're going to go ahead and start using the light. I'm just sort of moving this forward a little bit because I don't know if you guys are going to be needing to get off of the call, and I don't want you to miss the ending. So now this is a pulsating of the light. And what's really interesting about this is it's forcing the products down into the skin, and it can be simultaneously changed. Meaning if you have something on your nose or your chin and you're breaking out, I would use the blue light. And if you don't, I'm using the red light to force the product in. So we can go back to my voice a little bit. And we'll see here where we are. And
I could go ahead and simultaneously with one little bump of my knuckle, change it
Yep.
for the patient. They don't know. I'm treating different areas for different reasons. They're completely comfortable. Really tend to do a little blue on noses. And back to the red for around the mouth. Now we're forcing in the vitamin C. We're forcing in the eye cream. You can see the bright, fluffy, healthy skin starting to react to the light and all the products being forced in underneath. Have you had any problems with breaking out anywhere? It looks really
No,
good.
no.
Good. Nothing from the mask even. Okay. So what will happen then is the peel is really going to help you. You know, it's going to keep everything exfoliating nicely. You can go back to your Retin-A in a day or two, just depending on how your skin feels, mainly because of the weather, not because of the peel. Another nice thing is you can really work all the way back by the ear for patients. You can go down under the ear area really nicely when you put the product back in
pigment
this
tends to
area.
collect back
There's a lot
there.
of pigment sometimes that tends to collect in the back of faces. So you can really get this handpiece in there nicely to force the clear FX, the vitamin C, and all the brighteners in there that you need. How do you feel Skintrinsiq lasts for you, Lisa?
It weeks. I would say it lasts weeks.
Mm-hmm.
The most profound effect for me with the Skintrinsiq is its staying power. I found that it lasts for, like I said, for weeks, and that fresh face, healthy look,
Okay.
with all those qualities you've been talking about, brightness, firming, blah blah blah, all that
Okay.
stuff lasts. Like I'll run into a friend, I'll have a top knot, no makeup, just standing there, and she's like, "What are you doing? What are you doing?" I'm like, "If I don't know, it's Obagi. It's a new Obagi treatment. Go get one of those things. Just go do it."
That's great. Thank you. That's great. Glad to hear.
So we do the face, we do the neck. We're gonna
Confused because
maybe
again,
move on to show the video of how Obagi penetrates the product in. That's the next one. We got this from Obagi. So we're going to show this, then we're going to answer questions.
A new level of
Very
medical
short.
skincare is here. Introducing the Skintrinsiq system, the first device designed by the skincare experts at Obagi. The surface layer of your skin is a protective barrier against debris, germs, and sun damage. But it also keeps out the skincare products you depend on to help keep your skin looking vibrant and healthy. Other skincare devices remove a surface layer of your skin to bypass this barrier and apply products. The Skintrinsiq device is different. It relies on innovative pneumatic technology, a gentle vacuum that lifts your skin to open channels in the surface layer. Through these channels, impurities can be extracted and products infused. Every Skintrinsiq treatment begins with soothing, cleansing, and toning. Next, the unique Skintrinsiq handpiece is used to extract impurities. You can add optional blue or red LED light therapy for a variety of benefits without adding to your treatment time. After extraction, your customized Skintrinsiq treatment protocol is deeply infused. No matter your skincare needs, there is a Skintrinsiq treatment that's right for you. Products are infused evenly and thoroughly for enhanced results. Simultaneous blue or red LED light can be added to the infusion phase of your treatment as well. When your infusion is over and the Skintrinsiq handpiece is removed, the channels in the surface layer of your skin close to lock in your Obagi products. The gentle, spa-like experience and noticeable results of your Skintrinsiq treatment come with no downtime. Dynamic infusion helps jumpstart the benefits of your Obagi home skincare regimen, so you'll be on your way to a radiant complexion even sooner. Skintrinsiq from Obagi. Experience the next level of medical skincare.
Okay, so we'll take some questions. The one thing I want to say is, I always encourage you guys to try to, do several things. Don't get stuck in a rut and only do one, whether you see me or you see the physicians. I think it's really important to, that's why we did this as a, you can buy a package, but you're not just buying one thing. I think it's great to look at your calendar and think about what you can do and what you would like to do. Again, there's no need to know the exact peel. When you come in and say, Jill, I want a peel, and we talk about it, we talk about what you're using. A lot of people say, which one do I schedule? You can just schedule a peel and come in. I would definitely, if you're brand new and you're really worried, do a consult with it. If you're somebody that's had one in the past and you're like, look, I'm just ready to buy another package of peels, this is what I want to do, that's great. But I think it's always good to sort of review just to see where you are and what you're wanting to do. While we still have some winter months left, the aggressive ones are always going to be better. This person says she has some melasma in small areas on her face. What would be the best treatment? I definitely think getting in with the peels is good. Making sure you have hydroquinone, making sure you have retin-A, that you're doing those things at home when you're not with us. And then I would say, microneedling is also really nice. I actually do a combo with microneedling. So I do a stronger peel, a couple of microneedlings. Our microneedlings are in a series of 4 to start. And they are 1 a month for a series of 4. So if you do 1 peel, 2 needlings, 1 peel and 2 needlings, we can kind of assess where you are and how you're feeling. The needling are going to make all those little microchannels for all your products to work better at home, which I think is really important. It's going to help with your melasma. Sometimes, lasers, you're going to have to get the doctor's input on whether they feel it's the best thing for you. But a lot of times doing some of the over-the-counter things with me that are aggressive, but they're not too aggressive, will slowly get your skin to change and become better. We have to be careful with heat. Some people can get melasma from being red. So we have to, take that into account too. Without me being able to see you, I can't answer that too individually, but we definitely have a lot of things like that. So mild acne scarring, 18 years old, leftover red spots. She has heard of light therapy. So typically red spots are going to be treated by a laser here that is a green laser. It's called V-beam. Those are done with the doctors, that you're going to get a nice little assessment with them. They're going to touch the little red spots to make sure that the redness, the vascular portion of that goes away. When we're talking about melasma and hyperpigmentation, those look more like darker freckly looking things. The red are left over, and it's usually in a younger patient. When we're older, like me, you can sometimes have the red around your nose, capillaries from maybe you were in the sun too much, things like that. That laser also works really well on that, but I still recommend getting the skin to be healthy, smooth, breaking down some of the top layers, getting rid of some of that dead old stuff in the skin as it starts to mush together as we age. An 18-year-old doesn't have that much, but you can a little bit. And sometimes that's just from drying your skin out so much because you're tired of breaking out. You can make your skin not want to break out. And so even sometimes people even use rubbing alcohol and things that we kind of don't want you to do. So we can teach you many different things about that. Again, consults are going to be free, so you don't have to do anything. If you come in and you say, okay, I just want to talk to Jill and then I want to come back and schedule a treatment, that's totally fine. I also do them on an e-visit. So You can get on your iPhone, get next to a window, have your face totally clean. I'm looking at you, you're looking at me, we're talking. It's almost like you're here. That might save you a little bit of time, especially if you work from home and you don't get time off. You can maybe squeeze me in on your lunch real quick, and then you can get an assessment of what you want to do, by your little treatment plan, and kind of roll with how your calendar is as far as, okay, this month I have downtime, next month I'm going to do a Diamond Glow, then I'm going to try a Skintrinsiq. And I think, you know, just like we try different fillers for different areas, we try different lasers, we have many choices. You want to rotate them a little bit and see what your favorite is, and kind of come up with what your favorite outcome has been. And you're welcome. Is there any other questions that anybody else can think of? I'm not sure. So basically, if you buy 4 treatments, you can mix and match them. You get $100 off your 4th. I think you buy it basically as a gift card kind of thing. And then when you come in, you don't have to pay. Similarly to microneedling, microneedling is usually $1,500 for a series of 4. It includes take-home products, and it also includes what we're needling into your skin, which is usually growth factor. It can also be done with PRP. And in that case, I would partner with one of the physicians or Annie. How much for package of 4? So they're all going to be individual. Like I said, like if you do, I didn't want you stuck. So if you want to say, well, I only want 1 peel at 160. I just want to see, I've never had a peel, I'm kind of scared. You could do 1 peel at 160. You could do another one at 250, do a Diamond Glow at 200, a Skintrinsiq at 200. And that would kind of be your customized package to sort of pick and choose as you want, as one a month sort of thing. So again, if you think, well, I'm scared, I don't want to do a big peel, then you might want to, you know, take your time. Some people are like, nope, I'm just going to do the 250 and I'm going to go for it. So I give you every scenario that I can think of. You can definitely reach me via email all weekend if you're a Friday person. Keeping in mind though, when I apply the peel, you're not going to peel for 48 to 72 hours. So it's not like I'm going to put it to you on Friday and Saturday, Sunday, you're going to peel and you can go right back to work on Monday. That's not typically, if you don't want to be seen, you might want to get it done on a Wednesday, on a Thursday, and then you may peel the most on Saturday and Sunday. So I hope that kind of helps. And you do have to wear it home. So when you wear it home, you can have that little yellowy hue to your skin. Washing your face at night if you are a morning patient, washing your face in the morning if you're a late afternoon patient. So I hope that kind of helps knowing those things. Now, having the little peels in the Skintrinsiq and in the Diamond Glows, those are a $125 add-on. We're not putting that in this package. You can add it on or not. Some people do, like I said, if they don't have an immediate event, they're like, throw the peel in. I love it. I'm bright. I love it. Other people say, I'm going to skip it this time. I've been using a ton of Retin-A. So I try not to lock you in with a certain amount. I try to more customize what you need for the time that you're here. You know, hear how it went last time. What did you think? Some people that were very scared of peels that did a big one, they were like, now I'm a follower. Like, not going to change my mind. I absolutely loved it. So again, I have a very big peel business. Try not to be scared. We can do it together, but I think, you know, just getting the trust in having the right products at home, what to use, not overwashing your skin while you're peeling and things of that nature makes a lot of difference. You don't really want to get a peel that you don't peel, because that's not always the best outcome. We want to try to get you to peel a little bit. So I hope that this helps you guys to understand everything really well. Any other questions we can think of? Used Obagi for 10 years, but have never had a peel. Please provide your email. Yes, it is jillg@theparkerclinic.com. So, you know, call the front desk, make all you have to say is you were part of the peel event. You want to do either a virtual consult or a live one here at the clinic. Any location, I go to all 3 with Dr. Parker. Every other Monday, we are in Westlake. Every other Tuesday, we are in Willoughby, and all the other times I'm here in the Beechwood location. So let's see, Monday, I was in Westlake. So next week, I'll be in Willoughby on a Tuesday, and they rotate. So not next Monday, I will not be in Westlake. It kind of rotates, and Dr. Parker is with me, which is great. So if you guys are wanting to see her, yes, jillg@theparkerclinic.com. Our phone number 216-464-7333. And so we will recommend products for aftercare, meaning when you're at home and you constantly have to put moisturizer on, you will get a discount on those. It's 20% off. They're just ones that are not, you know, necessarily cosmeceutical and fluffy and really important to use with your regular skincare. They're going to be something that you're putting on over and over and over, and we know you're going to run out of very quickly. Again, you're going to get $100 off. You can mix and match. If you're a big peel person and you're like, I'm just going to buy 4, I want $100 off of my 4th. That's good. We did it this way so that you're not trapped into one scenario versus the other. So I hope you enjoyed the presentation. Anything else anybody wants to say? Oh, very helpful. Thank you. I appreciate that. You guys can always email me with questions, and I love the consults because, you know, I have to be able to see you to know what, and hear you really, to know what you're thinking and what you want to do. I encourage you to see everybody here at the clinics. We all work very well together. Again, Cassie and Annie also do some of these treatments with me. Cassie as a nurse. She does the Diamond Glows, Skintrinsiqs, and peels. Annie is our nurse practitioner, Botox, filler, all kinds of wonderful things with Annie. And she is now going to be doing some of the peels at our Westlake office to make them available a couple days a week as we start to expand everything there. You guys are welcome. Thank you so much for tuning in, and I hope to see all of you very soon. Have a good evening.